So today we're going to talk about the actions of ephedrine. Ephedrine is another commonly used drug seen in anaesthesia. We're going to look at the presentation, the mechanism of action, the usage of ephedrine, and the effects it has on the various body systems. We'll start off by looking at the presentation. Ephedrine is formulated as tablets, elixir, and also as solution for injection. It commonly comes in a 30 mg per ml ampule, which we dilute up to 10 mL of 0.9% sodium chloride, giving us 3 mg per ml of ephedrine, which we can then use intraoperatively to bolus. It consists predominantly of 4 main isomers. However, the active isomer predominantly is the L isomer. If we think a little bit about the mechanism of action of ephedrine, it's got both direct and indirect sympathomimetic actions, and it works by inhibiting monoamine oxidases, which predominantly are associated with the breakdown of noradrenaline. Because it's got this indirect and indirect action, it actually works in a mixed format against alpha and beta adrenoreceptors. By inhibiting monoamine oxidases, you allow the NORAD to stay around longer, which gives it more time to bind and activate those adrenoreceptors. One of the common things associated with ephedrine because of this is a phenomenon known as tachyphylaxis. So tachyphylaxis means that at a certain point, no matter how much ephedrine you give, you're not going to get an action from it. And the reason for that is because your ephedrine has essentially inhibited MOA, you've prevented the recirculation of NORAD into the terminal peripheral nerve terminals, therefore not allowing it to be reconstituted and re-released. So essentially you saturate the amount of NORAD that's available and you don't get any more made to be released to give further action. Hence why no matter how much ephedrine you give, the amount of NORAD that's there is just the amount of NORAD that is there. If we think a little bit about the usages of ephedrine, it's predominantly used to treat intraoperative hypotension or hypotension on the intensive care unit, and more frequently associated with that of regional anaesthesia-induced hypotension. It is commonly also used in the treatment of bronchospasm. It has a bronchodilatory nature. It's used in nocturnal enuresis and in narcolepsy. When we think about the effects, we can split it into the different systems. Cardiovascularly, it has an effect on cardiac output. It increases cardiac output, it increases heart rate, and therefore increases blood pressure. Consequently, though, has an increased action leading to increased myocardial oxygen demand and consumption. On the respiratory system, as we've said, it's a stimulant and it can cause bronchodilation. Renally, it can cause a constriction and therefore a decreased blood flow and therefore reduced GFR.